So a question that I get asked a lot about is what happens to scar tissue, and does this affect the efficiency of the muscle and the fascia itself? And the answer is yes, it does affect it completely. You see, let's say we have, I'm gonna represent it on my forearm here. If we have a scar and, on the surface it looks, it's healed well, we've got to understand what's happening underneath, because how clean it looks on top is not going to be the same underneath. That fascias and the tissue is going to be bound up underneath the scar itself, underneath the skin. And this in itself creates a big pull in the tissue surrounding it. So let's say, as an example, if I take the tissue, or if I take this towel, and this is representing the tissue. If we create scar tissue, I'm going to pinch this and twist. Note the whole towel moves in towards this direction. So this is going to have a direct effect on everything else surrounding the scar itself. Now the question is there anything we can do about it, and what can we do? And the answer to that is yes, there is something we can do, and I'm going to show you exactly what you can do. So I'm just going to use some massage lotion. You can use any sort of cream, anything like that. And I'm going to use this fascial tool, muscle scraper. The correct term is instrument assisted soft tissue mobilization tool. But with this, honestly, you can use pretty much anything. These are just in different shapes for specific reasons. Now all you're going to do, if I'm just going to put just a little bit on my arm here, say that's the scar tissue there. All I'm going to do, I'm going to take, because it's going to be a small scar in this case, I'm going to take the end of this and I'm just going to come across on the scar, rubbing across in all different directions. So what studies have actually found is that using these tools actually help to rehydrate the tissue itself. Now with scar tissue, it's all bound up, it's going to be dehydrated because you're not going to get as much oxygen, water, blood, nutrients all in that area, so it becomes dehydrated. So this essentially is going to help rehydrate it. Now again, you don't want to press too hard where it's painful, just again a very light mild discomfort, that's all. And again, you can go linear to the scar. If it's in this direction, I can go this way, but I also want to come across, kind of like a cross friction technique here. So if I hold it this way, I'm going to come just across it here, that's all. Now doing this, you can do this for about a minute, 2 minutes. You don't want to overdo it because it's still a scar at the end of the day, and we don't want to create too much micro trauma in the tissue because we want to help it heal and improve overall function. So again, 1 minute to 2 minutes. I'd recommend doing this every day, really, to be fair. And once you've done that, let's say for instance it is on my forearm, around about a minute to 2 minutes, again, nothing too hard. Once you've done that, you can wipe a little bit of the excess off, and I want you to hold, and I want you to start just to, remember in school when we did things like Chinese burns, where we used to twist each other's skin? I want you to do that, but not as intense, just a little bit, hold, and slowly release. You can go the opposite way, twist, hold, slowly release. And you can do that around about 10 times. Now if you combine this with the, let's call it a fascial stretch, do this every day, you're going to feel a difference in the area itself, but also the surrounding joints and the muscles as well. So to all those asking about scar tissue and what can we do about it, I hope that helps. As always, give it a go, let us know, and if you have any questions, feel free to get in touch.